rolling too.
Hi, this is Eric Stoller here today for the Eric Stoller Show and the Man on a Mission series. I'm here at Studio 111 in Hollywood, Florida, and I'm here with Dr. Asare Christian. He's visiting us today from Philadelphia, Pennsylvania. Doctor, welcome to the show today. So you just came in this morning. I'm sure your arms are tired, but so tell us a little bit about you, because let's really first, coming on the show, and the show is really about wellness and really interviewing and finding out, people on not only their journey, because I know you have a journey, your own health journey, but also your journey of helping people heal.
Absolutely.
So welcome, and let's hear a little bit about who you are.
Yes, thank you so much for having me, Eric. I'm honored to be here. And my background is in pain management. So originally I'm from Ghana, came to the US when I was 16, got into pain medicine, treated people with pain for about 8 years. At that point, just blocking pain signals, recognizing that there is more that we can do for people in terms of pain. So I got into a different space where the focus of solving pain became, let's not just block the signal, but let's figure out what is driving that pain state, which is a function of people's health. And I'm sure we're going to get into that. So super excited. All of that journey has now led me to really now getting into longevity medicine, where we can actually slow down aging, because we know that as we age, then disease and health become dysregulated. So that's why I'm here.
I got it. And so coming from Ghana, what was that like growing up in Ghana before he came here to the United States?
Yeah, it's very different. And, this is a while ago. So Ghana in West Africa is, low, medium income country. So we don't have a lot of health infrastructure compared to America. So growing up, it was simple life, but, just a lot of happiness. I saw some disease and other things that people struggle with that actually influenced my interest in medicine. But it's been great being here, having had a training here. I have family here. So I also feel like, I have part of my upbringing here as well, which is shaped who I am now. Yes.
Awesome. And so your experience here with, working to, I guess, university and going to medical school. So what gave you this shift going from working, in hospitals and American medical system to now shifting more into the longevity space?
Yeah. So, doing pain management, and as you know, in America, we have a lot of pain. Pain affects a lot of people. And it turns out that America makes out about 4% of the world population. Yes, we use 80%. Yet we use 80% of the world opioids. So how we treat pain here is very focused on symptom management. So what I saw was people coming, I would do procedures, I would do injections, and they keep coming back. We order MRIs. It's not helping. They go to physical therapy. It's not helping. They go get surgery, and they're still in pain.
So we call this symptom management.
Symptom management.
So they're not really, they're not coming, like you said, the root cause. They just keep treating it, and the doctors are happy because every time they're getting paid for their work. So we can, so again, I guess that's also the side of, the ugly side of medicine.
Absolutely. How we finance medicine in America determine how we deliver medicine.
Yes.
We pay for MRIs, we pay for surgeries, we pay for medications. So that's what doctors do. We don't pay for nutrition, we don't pay for training, we don't pay for you to go get psychological help. So it's just how it's designed, and it's really not about really serving the person who needs healthcare. It's about the people around healthcare who are gaming the system. So that needs to be changed, and we have individual responsibilities, and that's how I stepped out to find a different way of helping people.
Exactly. Hey, this is Eric Stoller for the Eric Stoller Show and the Man on a Mission series. We'll be right back with Dr. Asare Christian. Hi, this is Eric Stoller for the Eric Stoller Show and the Man on a Mission series. We're back here with Dr. Asare Christian. And so he's been talking about the symptom, right? We go to the doctor, I got a pain issue, he fixes it. Like I go to the chiropractor, I'm good for 3 days. Then I go out on the weekend and then, I tweak something again. And, we're going to get into root cause because, as I share with you my story, I lost 100 pounds.
Yep.
And there was a point, so at 46, I had a heart attack.
Mm.
And then I lost all this weight. But what I did was I went back to my old habits. I stopped the things that caused the heart attack, but then quickly, as most people, you fall back into what's familiar and comfortable. And all of a sudden, thank God, luckily, I didn't have another heart attack. Because somebody said, hey, you're going to be open for, I had stents, you can be ready for open heart surgery.
Mm-hmm.
So, again, how can I put it? I made a conscious effort to try to get to the root cause. And as most people, I don't think it's one thing.
Yeah.
I think it's a little bit of what's going on with the gut and the inflammation and the body as a whole and chronic and autoimmune. And then it's mental health, which I think is number one, because when you see a person who is, I have a mother with Alzheimer's, or a person that's homeless, I don't know if they're homeless because, and there's a gentleman that lives around here in Hollywood. I believe he's homeless. But if you saw the man, you would say, why? But he's lived that way for many, many years. They've become attuned to what you and I would think would be, abnormal.
Yep.
And so take that and take stress and then take pain, like that's a whole different level.
Yep.
But let's go back to what you talked about symptom and then root cause. So tell me along your discovery here about root cause, what you uncovered that's kind of moved you in a different direction.
Absolutely. And that's an important concept because, in fact, when we talk about pain, pain is not a diagnosis, okay? There's no diagnosis code for pain. Pain is a symptom. So what's driving that symptom is what we have to go after. And in simplistic terms, what is driving pain is a state of your health.
Okay.
So at the base of it, we have inflammation. There's all these cellular things that are going on. There's biomechanic deficit. There's also the brain. We'll talk about the brain. All of those systems are not working well. So how we get rid of pain becomes optimizing the body in a healthy way that the body can take care of itself. You're made up of cells, and all these cells have the intelligence to adapt in a healthy way when they get the right signal. And what is the right signal? Nutrition, sleep, stress, exercise, movement, peptides, hormones, all of those things plays a part in optimizing physiology. So I think it becomes necessary when we're trying to get to the root cause of pain to look at all of those factors from a lifestyle standpoint. And the brain plays such a huge part of it because pain is actually an output from the brain. We can cut off your legs and the leg is not there, and you can still experience pain in the leg that's not there.
Wow.
So the brain is that powerful in modulating pain, and it's also important for people to understand that not only are we optimizing physiology, but we also have to work on the brain when we have to get to the root cause of addressing pain.
Okay. So there's I read a book years ago by John Sarnow.
Yes, I know Dr. John.
And I at the time I had been listening to the Howard Stern show.
Yeah.
And Howard Stern used to say that book changed his life because he always did with back pain. Now I experienced a lot of that when younger. I would travel and all of a sudden I'd be in such pain I couldn't walk.
Yep.
And the same thing after my heart attack. I'd have, oh my God, it was anxiety and stress pulling the muscles together to like debilitate you. Crazy.
Absolutely. The pain is so much influenced by stress response. People wake up one day and go, I have no idea why I have this severe pain. And then when you talk to them and say, what has been happening? Maybe they have been having a lot of stressful life. They just lost somebody in their family. And I go, you don't need an MRI. You've had lost somebody. Your whole system is upregulated, right? There's hyperactivity of the nervous system. So all of those things have to be taken into account when we're really trying to get people to understand what pain is. And it also starts with really getting people to understand what is pain.
Right.
Okay.
Yeah.
People experience this pain. It's a subjective experience. When you go to a doctor and you're telling them I have pain in my back, they don't really understand. I mean, yes, it's a very subjective experience.
Yes.
But we know what influences it. So it becomes necessary for the person who is dealing with pain to understand pain. And then from there, work on the factors that is keeping them in pain.
Now, that's critical. And so what do you find typically are like the main factors that keep people in pain?
Yes. So before I talk about that briefly, people understand what triggers the pain. They know like the precipitating factor.
Okay.
I fell on an ice, or I went to pick up a piece of paper and then my back has locked up. I've had surgery and they're still in pain. But what is keeping people in pain in a simple way, as I've talked about, is a function of your health. Sometimes it's unforgiveness. The brain is that powerful, okay? Stress. They're not sleeping. If you don't sleep, pain doesn't get better. Because when you don't sleep, cortisol is high. Cortisol is pro-inflammatory. It keeps inflammation going, okay? There's biomechanic deficits. There's weakness that happens when people have pain. So you also have to work on all of those things. So microbiome dysfunction, they're eating things that are not good for their body and creating more inflammation. So lifestyle is what keeps people in pain. And then it becomes what else is happening in their life from a cellular standpoint. Is it hormonal imbalances? That plays a part. Testosterone, estrogen, progesterone, all of those plays a part in how we process pain. So all of those things become necessary for people to understand. But first and foremost is the lifestyle and the mindset that people need to dial in to help them get out of pain.
And and it's interesting that you say that, because as I was talking to you earlier about a gentleman that I was with, and he's like telling me, his foot is the shoes, and he's been on his feet all day, but he's carrying the equivalent of 70 pounds around. And you can be in what we call denial.
Yeah.
I mean, I was in so after I had my heart attack, to give you an idea, I got into great shape. I probably was in just as good or better shape than I am now, but I was also younger, right? Because the reality was today I've been starting to work to increase weight, and I added an extra 10 pounds, and I didn't have a spotter, and all of a sudden I was like, I'm in trouble.
Yep.
And I'm like, I almost felt like I knocked my hernia, because I'm like, all right, that was and it wasn't that much weight, but it was enough that, I was not, I didn't have it all there. So I guess my point of all of it is like, a lot of people get into that point where they're either living in their past life. When I was 24, hey, bud, you have a lot of generations of your life. Even at 46, I had that. Even my metabolic age, I'm still 59 years old, right?
Yeah.
And so when I had that first turn, I lost all this. Not only did I lose weight, I got into and I didn't use any biologics. It was all, I did it at that time with my own body weight. So my question to you is, what do you think happens? Because people are on this, I got the pain, you go to treat them. And why do we slip back into that, what I'll call, as Brian Tracy likes to call, that comfort zone? Why do you find that, instead of just like, hey, I've got to the point, and I have those days, but I just keep pushing forward because I'm too fearful of what the other side could be if I don't keep going?
Yes. So everything that you say makes a lot of sense. And one of the things that I always talk about, which is something that we actually discuss, is that people's habit is a lagging indicator, or people's health is actually a lagging indicator of your habits. Okay. So the habits that we have is what pulls us back. It's hard to change habit. Okay. So when people have all of these habits that are influencing their health, and they try to change it, and they don't spend enough time to really solidify those habits. It takes about 6 months to do all of those things. People tend to go back. And then the other side of that is the environment. Okay. So if you're trying to change habits, if you don't want to, drink as much, if you don't want to eat unhealthy food, and you put yourself in an environment where people are doing that, then that becomes an issue. So really, the science of habit change is actually something that I talk about with my patients, teaching them, how do you change new habits? Because it's not just one day, like you said. Yeah, you can do it for a couple of bit, but how do we make those things habit? This is how I eat. This is how I move. This is how I sleep. And of course, it's all about balance. So if you can do those consistently 80% of the time, the 20% of the time that you're not able to do those things, it's not a big deal. So really giving people strategies, and I think it's also human nature, right? We have this system in the brain, and it is this default mode where we tend to go to a place where the brain doesn't have to exert any energy, right? And there's entropy. Things are always moving towards disorder. So for you to be able to kind of get things to move in the right order, you have to put energy in the system. And that takes some conscious effort, and that takes, being aware of things to help people to get back in tune.
Well, I tell you, developing positive, healthy habits is not an easy thing today.
It's not. Yes.
And this is Eric Stoller here with Dr. Asare Christian. We're going to take a quick break, and we're going to be back, and he's going to share with us the things that you need to do to develop those healthy habits. We'll be right back. Hello, this is Eric Stoller. I am here at the Amrit's 103,000 square foot facility, their wellness spa and retreat. Now, this is such an amazing location with 4 stories of saunas, steam rooms, grounding technology, hyperbaric chambers, red light, IV therapy, the list goes on and on. So while you're enjoying your weekend here at the conference, find a time to come to the Wellness Center, take a workout, take a yoga class, take a cycling class, and enjoy all the amazing treatments they have here for you. So again, I'm inviting you here to the Amrit for the AIMS conference hosted by Boston BioLife. My name is Eric Stoller. Click the link to find out more about the details about joining us for this once-in-a-lifetime opportunity. Well, now he's different now.
Yeah, I'm not bored anymore.
Yeah, I can. All right, this is Eric Stoller for the Eric Stoller Show and the Man on a Mission series. We're back here at our beautiful studio 111 in Hollywood, Florida. By the way, if you're looking to book your podcast or your next music rehearsal or recording, give us a call here at Studio 111 and we'll be more than happy to accommodate you. So back to our show with Dr. Asare Christian. We talked about habits. And, you know, it takes 21 days in the world of motivation, they say, to create a good habit, right?
Yes.
So where does it start? I know on my end, being in the world of motivation, setting a goal, right? Writing them down every day.
Yep.
You said something, you know, that goes back to the AA philosophy, people, places, and things, right?
Yep.
And I'll tell you, I'm hanging out with my friend, right? And when I hung out with my friend all week, and I said, I'm not drinking, but I'm out with him, and he goes, oh, have a little bit of this and a little bit of this.
Yep.
So over a little bit and a little bit and a little bit turns into a lot, right?
Yes.
And so one of the hardest things I really found was when I'm on my health journey, a lot of my friends are not on that same journey.
Yep.
So like yesterday, I go out to lunch with my friend, and what did we have? We had a salad, okay. I got wings, fine. He wanted a pizza. Okay, so I had a,
Yeah.
So we bought the pizza. I brought it back to the house for my wife to have some. If I told you I had 3 more slices of pizza in the last day, because I brought that into my home.
Yes.
So I want you to really take that, because it's also the environment. And like I live with a wife who I actually do my own cooking, because her diet is she has a cup. And I go, what's in that cup? And she goes, diabetes, right? Because she's eating cake and sugar and all of that. And so I've personally conditioned myself to work around it.
Yep.
But I want you to address this, because I think people kind of fool themselves thinking you can go half in and you got to go all in. Like right now, my workouts, I've kind of intensified them. I went back to my trainer. I'm like about to rip everything out of my refrigerator that doesn't belong, because you've got to create some disruption. Would you agree?
Absolutely. And the habit thing that we talked about, it takes a long time. So what it is really getting people to get clear on their goals. What do they want?
Yes.
Okay? So when people have real meaning and target as to why they're doing what they're doing for their health, then it makes sense. So I ask people, like, what's important to you? Well, some people will say, I want to live long enough to see my granddaughter graduate. I want to be able to have the energy to be there for my kids, to be there for my wife, to be there for my community, and all of those things. So we kind of have a goal of, this is the why, getting clear on the why. And then from there, we talk about the science of habit change. There is a science to it, and it starts with the very things you talk about. First of all, there's a way you want to remove yourself from the environment.
Yeah.
If you want to start a new habit, you stack it to something that you already does. Okay. So for example, if you want to start a meditation practice and every morning you drink coffee, maybe right after your coffee, which is a habit you do every day, you sit down for 10 minutes and you do meditation. You also have to have implementation intention. If you're going to go start, like, for example, a workout regimen, you have to set the intention to say, hey, 5 a.m. in the morning, I'm going to get up, I'm going to go to the gym, and I'm going to do this. So you have to, and then you have to put yourself in that place.
Okay, so let's say that implementation
Intention.
intention. I like that. You need to coin that.
Also, that's
Implementation
actually
intention.
Clear. If there's a guy who wrote a book about habits. I think James Clear. He talks about this whole science of
Okay,
influence.
okay,
It's
got it.
something
So
that
is
I
it,
got it from them.
you
Yes.
got it from that's but I like that word because it's kind of like Tony Robbins talks a lot about a pre-frame.
Yes.
Right? So you're like you say to somebody, okay, so you pre-frame, this is the idea of what you want to put in there. And I think that's important because I know initially when I started working out with a trainer, it was like, oh my God, I got to work out with a trainer.
Yeah.
Then it became like, I got up in the morning because I got to cancel the session. I'm like, what the, it's like, come on. So it's that
Intention.
side of the, like you
That's
look
the
forward to it versus like, wow, that I'm like, I don't like it. So I'm sorry, I don't want to cut you off
Absolutely,
there.
and that's important. And then the other thing that I think people also need is like willpower. That's tough to do. Sometimes there is physiological things that influence people's choices. Okay, if you're not eating well, if you're eating junk, even your mindset to make those decisions don't work as well. If you're not moving, if you're stressing, so all of those things influence our ability to even manage habits. So it all starts about optimizing the physiology, because I always say I think it's much easier to hack your physiology than to hack your psychology.
Yes,
Sometimes people don't even have the right chemistry to be able to make those decisions. So it's
it's so
all about
true.
doing the healthy things, then you start making better choices.
So I totally agree with you, and I definitely think about that because you're drinking alcohol all the time, which is sugar, and your brain
Yeah.
is sugar,
You're
sugar,
not
sugar,
sleeping,
sugar.
microbiome is messed up.
Yeah, yeah, and it's funny because I don't have great sleep patterns, right?
Yeah.
But I kind of cheat it. I sit in the hyperbaric chamber, I'm injecting myself, I'm working out, but at the end of the day, I could be in a meeting and all of a sudden it's happened a few times and I nod off and they're like, and I'm wake back up, but it's like,
Yeah.
and it's like literally like, am I boring? I'm like, no, my body is just like at that point, it got nothing left. It's
Yeah.
like, Eric, you're like,
Yeah.
which is kind of like, whoa, you taking it all the way to the end,
Yeah.
know?
Exactly. You got to take care of the body. And right now we have so much understanding of how to replenish the body.
Yes.
We have peptides, we have hormones, we have biologics, we have small molecules. So all of those things helps us because the environment that we are in is much toxic, is much hard to deal with. There's a lot of stresses that influence our physiology.
That's right.
Yes.
That's right. And, and I find interestingly enough, I'm from New York and I was just back there and my friend Mark who called, we spoke to, and he introduced me in New York. He's in his late 70s, but as I was saying to you, he's lifestyle. Lives in Long Beach, rides the bike on the boardwalk every day. He has lots of community, knows everyone. Everybody stops by and says, hey, what do we did every day? We're on the porch and the sunlight is directed. I use all kinds of stuff. My skin was better in New York because every day I was getting direct sunlight. Here it's been overcast. And you just notice these little things. We'd walk in the sand. Why? Because we're grounding ourselves in the sand. So you think about our ancestors, right? We're spending money on red light beds and hyperbaric chambers and salt. And what did they do?
They had access to it. Yeah.
Light, water, air. You step outside, right? Look at us. We're in all this beautiful place, but look at all the electric that's surrounding us right now.
Yeah.
Yeah. And I think as humans, we get so caught, especially Americans, get caught up in the whole thing of go, go, go. I got to run Jenny to the soccer practice and little Ginny to the ballet. And then all of a sudden, mom's got an issue because mom hasn't been to a doctor, right? Blows a gasket.
Absolutely. All those stresses, the body keeps score of it. And people need to, like when you develop a disease, it doesn't show up overnight. These things have been happening for the last 20 years, the last 30 years. So even in the space of longevity, I tell people, heart attack just didn't show up. Your heart attack didn't show up. You've been kind of living some lifestyle and some other stresses that potentially put you there, right? Of course, there's genetics, but we know that genetics plays a small part of it. It's the epigenetics. It's what we're doing in our environment, the choices that we're making, what we're eating. All of that influence health. So it becomes really necessary for people to understand that you have to understand what's going on with your life. And more importantly, as we age, things change. You talk about the fact that sometimes people are like, oh, I used to be able to do this. So that resilience to be able to go out, drink, have fun, and all of that, it's not the same. When you hurt yourself as an older person, you don't heal as fast. Why? You don't have the same cytokines that you had before. You
That's
don't have
right.
the same growth factors. You don't have the hormones. You don't have the collagen. You don't have all these processes that used to help. So it becomes necessary to also understand where are you and what we need to do to optimize where you are. And that includes bringing these compounds that we talk about, where
That's
some
right.
of your friends will say, oh, I don't want to take this. I don't want to do this. And in fact, when it comes to peptides, these are something that your body actually makes. So it becomes people need to get help from providers who understand some of this concept to make sure that wherever they are and wherever their problem is, I treat pain differently for somebody who's 40, who's 30, who's 70, who's 60.
Absolutely.
And that's how it should be, right? But in conventional medicine, we give the same injection to everybody else and we give the same medication to everybody else, and then people develop side effects and all of those problems.
Yeah, and it's, and that's the issue. I remember first I took a medication for my heart, and the doctor said, well, what should I do? He goes, well, see how you feel, and if you get headaches and it doesn't work, I'll put you on the name brand. I took a nitrate for years. And let me tell you what happened to me. I was on the Perlanta. I was on a Cardivolol. I'm on, I don't know, it was about 5, maybe 8 or 9 medications, all right?
Yeah.
And we just keep adding more. Oh, you got something here. We'll give you this.
Yeah.
You give you this. I remember taking this one thing for anti-anxiety, but then I said, Doc, every time I take it, I feel like I'm having respiratory issues, like I can't breathe.
Yeah.
It was Buspar, right?
Mm-hmm.
I had anxiety issues,
Yeah.
so I stopped taking it. But then all of a sudden I'm like, all right, what's going to happen with the signals in the body? When I lost all the weight, first my cardiologist, who was the head of the Aventura cardiology for the whole hospital, I'm like a poster child, right? Here I am, a 40-something-year-old guy walking in, and everybody in there's a heck of a lot older than me, and pay attention. So I paid attention at first. Mm-hmm. And then I stopped. And then, what's interesting, he's like, I had to go for surgery. And he goes, all right, we gotta do the stress test. But he's like, all right, I'm dropping your blood pressure med. I'm taking you off Plavix.
Yeah.
I'm taking you off this. So literally the weight loss, the only thing I'm on now, I'm still taking Entresto, and he had me take it because during COVID I lost some. I had a really bad. And then I take a half a blood pressure pill, and I take a baby aspirin.
Yeah.
And I take a statin at night, but half the time I don't even take it. And my point is, it's that quite honestly, at some point, I've had doctors say you'll never be off the medicine. And this is why I think things are so screwed up, in my opinion, because now you got somebody taking 22 medications by 6 different providers, when in the end, they probably just need to detox their whole system and then kick ground sterile.
Absolutely. And that's what I actually see in pain management, where one of the things I see in a lot of women who are going through menopause, right? When you lose estrogen, testosterone, all of that influence your mood.
Yes.
They go see a doctor. They don't check their hormones. They just say, take an antidepressant.
Right.
Okay? And then they gain weight from the antidepressant. And they go exercise. It doesn't work. They have pain. Then they put them on pain medications. So, and all they need is just some hormonal balance. Going to the cellular level to balance those things so we don't have to address the symptoms of menopause with 3 different medications. And then there are side effects. These medicines are not benign. So I think it's really necessary for people to understand and believe how powerful the body is in healing itself when it gets the right signal.
Exactly.
It's all about the right signal, and it's lifestyle, and then sometimes it's hormones, and sometimes it's peptides. All of those things that actually solve health. A lot of the medicines that we have in conventional medicines are there to solve sickness. So people need to understand the place for agent in pharmacology that helps with health, and agent in pharmacology that solves sickness. And a lot of people get put on those things instead of, how do we fix this problem?
Yes.
Let's fix your gut. Let's get you to sleep more. Let's get you to move. Let's get you to have some hormones. All of that helps people. So a lot of medicines create a lot more problems and then we tend to do more here in America compared to other places. Okay, like I talked about, we are using 80% of the world opioids. Are we the only people with pain?
Right.
Right?
Right.
It's the environment, and it's also how things are structured.
Exactly.
systems.
Environment. And you're in a society where everybody is like moving at a million miles an hour. So what are people doing? Going through drive-throughs.
Yeah.
What are they doing? Listen, I drink a lot of coffee, right?
Yep.
I mean, everybody like, oh, don't drink this. Zero sugar. I know this is bad. It's one of my bad vices. So
Yeah.
I'm not drinking enough water, but I'm drinking coffee, right? I don't use sugar. I throw my amino acids in there. But that's a habit I need to break. But my old habit was, hey, you know when I'm stressed out? I go through McDonald's drive-thru and I'll have a Big Mac because I really like it. I can't tell you the last time I've had a Big Mac. I can't even mentally think about going over there.
And you're not even gonna feel good. You'll feel miserable when you eat it. It's not gonna be the same, right?
Right. Right.
Yeah.
And that's the other thing which you don't realize when you're eating and your body is just used to it. Like if you drink all the time, right? And I can tell you, I was never somebody that was drinking every day, but there was a point like, oh, you know what the best way to get over the hangover is? Have another drink. But now it's like, hey, now what do we do now? I laugh because I was with somebody who's coming, and last night she's like, man, I'm so tired. He says, what do you got? You think you used to be, oh, we're going to get some party stuff. No, she goes, you got glutathione?
Yeah,
you got NAD?
Exactly.
You got this? She goes, come on back over and bring that. We're going to have a party. And you laugh. And that's the new crowd, the longevity crowd of, we don't want to have a beer, but we want to have a mocktail, right?
Exactly. Yep. And it's also, one of the things I talk to people about is all about balance and resilience.
Yes.
Right? So for example, you exercise, you do need peptides, whatever you're doing. If you have a lot of Monster as part of your paradigm of things that you do, it's still okay because the whole idea is like we also want people to live. Okay?
That's right.
And I think in America, especially like you said, we have this things where we are so kind of sometimes, and it's just a system that's structured that way. People so focus on weight and other things. Like we've done studies. I have a public health background where we've done studies where you ask Americans about what do you think about ice cream. People go, oh yeah, I'm gonna get fat. But in Europe, you ask people about that, they think about its enjoyment. It's all of these things.
Right.
So it's all about balance.
Right.
And knowing where you are in terms of what are you doing that these things are okay to put in there once in a while, because that restrictive life and the whole idea of I can't even go hang out, I can't stay out because I want to go to bed at 6 a.m. I'm hanging out with all these longevity doctors. That's not what it is. It's about community. Okay, so those things are also important in context. And then when you're doing all of those other right things, the sleep, the nutrition, and everything as well, a drink. I know some people who are absolutists, like don't even do this. But in communities who are living longer in the blue zones, they do these things and they're still healthy.
Of course,
So of course.
It's all balance and moderation. Like, look, I've had my things and I stopped drinking, but I'm not going to say, oh my God, I had a drink. Oh my God, the world. No, I'm not somebody that worry that I'm going to end up under a bridge with a bottle and I'm going to have a binge horrible experience. I know how to control it, right?
Yes.
And like you said, in France and many countries, there's nothing wrong with some wine, with some alcohol. Think about like whiskey and scotch, right? Think about you as a doctor.
Yeah.
That was one of the medicines here. You got a gunshot, have a swig of scotch. It'll take the pain away, right?
Yeah.
So, everything has its place. Even drugs of years ago,
Absolutely.
the big corporations used to sell, cocaine and heroin where you're like, how did it go this way? Because people figured out, hey, it's not medicinal. I can use it for pleasurable things. So I think the world we're in now, and this is my own view of somebody that's why with Man on the Mission, my whole goal is to have these conversations with your people like yourself, and we can kind of give this, the biohacking crowd, they're into it, they get it. But I'm talking the average guy or woman who was like at that seminar last night, or my sister who's an executive who's dealing with hormone issues, and now her wall has gone smaller and she could have a cancer issue. And then I talked to so many women, doctors too, that are dealing with these perinatal or this and it's like they can't figure it out.
Yeah.
And it's like you said, it's what's the hormone imbalance? Maybe the body is toxified.
Yep.
My friend Mark, and this is why I've really kind of like made myself attune, and I've got a work in progress, as you can see my shift because of whatever.
Yeah.
That's work in but it's the holistic side of, hey, this guy Mark, he was the first yogi in New York in the 70s. He opened the first yoga studio. They said, what is it,
What
a
is that?
yogurt
Yeah,
studio?
exactly. Yeah.
And then the stuff that you're doing on the spiritual world and herbs and all this, today it's very commonplace. So I want to ask you, when you talk to the average person, who they go, hey, Eric, oh, wow, you lost that weight. Yeah, I'm going to do some intermittent fasting and I go back on the treadmill, which we know, like I call it the world of denial.
Yeah.
Or, yeah, I got the pain and it's my shoe, but my gut is hanging out that I can't even fit into my clothes. Or I'm like, hey, yeah, I've had this head injury over here for a while, but I don't know, I'm going to go to the bar this afternoon and I'll be good. It'll go away. What do you say to people?
So I think what people need to recognize is that the body has all the intelligence to adapt in a healthy way or in an unhealthy way based on what's going on in the environment and what signals are being put into the body. Okay. And then for most of us also, there's awareness. You become aware of it. Most people don't feel good when they drink.
Yeah.
Most people don't feel good when they eat certain type of food. They still do it.
Right.
Most people don't feel good when they don't sleep enough. So there's all these signals that the body is telling them. The body is like saying, I can't do it, but we don't listen. So people need to really listen to their body. Okay, your body will tell you. Your cells has all this intelligence. I'm sitting here and I'm talking and I'm listening to you. It's a function of all these cells that are doing all this work. It's actually very miraculous when you think about it.
Yeah, sure.
So the cells in your body have all this intelligence that we have to trust and listen. Okay, and this is a vessel. This is the one body that you live in. And how it functions is it requires proper nutrition. It requires proper movement. It requires proper modulation of your autonomic system or your stress response.
Yeah.
All of those things are important. So people need to start listening to their body and they have to take actions. And you can validate this for yourself. When you don't drink, how do you feel when you sleep? And
Feel
especially
much
for
better.
patients who have pain. I'll tell them, they go, I have no idea why my hands is all swollen up. I woke up this morning and my migraine is up. And I say, what did you do in the last 48 hours? They were drinking beer, they were eating pizza, something. It doesn't mean that you don't have to eat that.
Yeah.
But if you're getting that signal from your interactions, then you need to listen. And that's even more powerful than sometimes the labs. People go to doctors and they do all these functional medicine things. But if you can sit down and listen, how did this food make me feel? How did that affect my mood? How did that affect my thinking? How did that affect the way I interacted with other people?
Right.
There's all of these signals that we can get if people can just sit a little bit and listen. And I know that's hard. So if you can't do that, then you want to see a doctor who understands going to the root level where we can understand what's going on within your biology. What are the dysfunctional things that are happening? You're made up of cells, and the cells have to make energy. It has to get rid of waste. It has to communicate. It has to do all of those things. And all of those things require proper nutrition and all those proper signals. So to be able to understand what's going on in your body can also come from a clinician who can do all those workup to kind of show you that picture and say, hey, sometimes people need to see it.
Yes,
Right?
absolutely.
Because people are so tuned out that they can't even feel, like you said, I remember when we were young, I'll go to McDonald's after, college, all night, you drink and you're fine.
Yeah.
Now I can't do that anymore. I feel miserable. I feel horrible.
Right. It can take days to recover. That's what
Exactly.
you don't realize. Like 2 days later
Yes.
to recover
You're
from
still
something like
recovering,
that.
But I've listened to that signal. Whereas I still have people around my age who are doing the same thing.
Yes.
They just kind of feel crappy, but they're used to that same signal. So it's really important for people to listen and to see guidance. If you can listen, you can change a whole lot.
Absolutely. And I think that goes back to the point of what you said earlier, is setting some clear goals. Because if the goals in your life, for example, are about the relationship with your spouse or your children, and you're like, what does that look like?
Yeah.
You talk about sexual health, right? If you're like being that, oh, well, my wife, she's not interested in me, and I don't know, I'm going to get a girlfriend. And I'm like, well, if you're 70 pounds overweight and you're in the bar every night and you come home, what interest does she have?
Absolutely.
I say this from personal experience. All of a sudden, my wife's like, oh, you better not be going here. Oh, you're looking good. It's like, wow. I'm like, all right.
Yeah.
And, it says for self-esteem, because at the end of the day, look, when things aren't working in a relationship, we start blaming the other person. When you go like this, you got 3 fingers pointing back at you when you print this way. So the fact is it takes 2. And then if you're on your own. You see, this is the thing that I want to encourage people, and I think you as a physician and somebody dealing with people is, do you got a support structure?
Yes.
You know, I was able to do this because regardless, my wife, she's fit, but I had support.
Yeah.
You know, my family supported me. I always wrote this at the top of my list. I had to go to extreme, and I share this. How did I stop drinking? I just got tossed out of my favorite bar, and not having a bar fight.
Yeah.
They moved my seat. I made a scene. I walked out. I didn't pay my bill, which I've been going to 20 years. We paid it the next morning. And I kept calling up saying, I'm going to sue. I'm going to do this. I don't even remember half the stuff I did. I did such a good job to this day. Guess what? They don't let me in.
Yeah.
But that's good.
Yes.
Because I went there a few times and they did let me in, and I ate. I sat at the bar, and then that was him going, no, we're not letting you back in because we don't want you to go to the place. So this is what I want people to remember. If you're going to go and then you're going to go see you and you're going to go through these protocols and you're going to do peptides, you're going to manage your pain, and you go exactly to the place, you're going to hang out with my boys at the bar, what's eventually going to happen?
You go back to the old habits.
So guess where you need to go? You need to go to the gym. You need to join a paddle tennis.
Friends who are doing
Find new friends who are doing the things you want. It's like in making money. What's the first they tell you?
Yeah.
Your income is going to be average of the 5 people you hang around the most. Yeah. I know when I hang out with people who make more money than me, I make more money. When I hang out with broke people, there's no money in my pocket, man. You know, that's not good. So I want you to share with people if they want to get a hold of you and get a consultation. And I know you're based in Philadelphia, but I know you move around a lot. You travel. I'm sure you see people. You do telemedicine. How do people connect with you to at least get a consultation, have a conversation, and see if you can help them with their situation?
Absolutely. Thank you so much for that opportunity. And what I do as a pain management doctor is, and something that's different about me, is really having a global perspective, multiple lenses. Okay. So what I have done now is to really look at ways that I can help people from a whole person perspective. I can solve your pain, but I need to solve your gut. I need to solve your habits. I need to solve your hormones. I need to solve all of those things, the toxins, everything else influence people. So that's something that we do that's quite unique from my background. And we are in Wayne, which is a suburb of Philadelphia. And my practice is called Ether Medicine, AETHER Medicine. And people can connect with us either through Instagram, or they can go to our website, www.ethermedicine.com, or they can also call 484-803 1101. I almost forgot that. 484-803-1101. Reach out to us. I'm interested in educating people. I'm interested in collaborating with people, and we can support people from different states. I do telemedicine, and we focus on the cellular medicine, and putting all of that together to help people to have a better way of health.
Absolutely. And you also, as a practitioner or a lecturer, so you do lecture at different conferences around the country.
Yes.
Maybe you'll be on one of our conferences soon enough.
Absolutely. And I've also been a forum for Longevity Fest. So, come check it out. And I'm looking forward to coming to your conferences as well.
Oh, absolutely. We're in Las Vegas?
Yes.
Yeah, we'll be out there. We'll see you out there for sure. And, more than anything, when you kind of, go into this side of what I call the regenerative medicine, the people that you work with, they don't feel like, healthcare. They're all excited.
Absolutely.
I'm working with doctors who are in their late 70s and 80s. Why? Well, one, they're in the regenerative space, but they see, like maybe they were surgeons doing, for many years. Yeah. Now they're seeing things where they can really help people that they probably knew 20 years ago they couldn't help them. And they can really move the needle. So it's an exciting time. And people want to live longer.
Absolutely.
But I will say this, I don't want to live longer and be in pain, be in a wheelchair. Yep. Brian Tracy says this on one of his programs, and he says they interviewed a man that lived to 100. He goes, what would you do different? He goes, I would have taken much better care of myself.
Absolutely.
So I want to give you a final word before we wrap up. What do you want to do to inspire, motivate, share people about you, Dr. Asare Christian, and why they need to, click on a link, meet with you, get to know you, because I know you're going to be a big leader in this field in years to come.
Yes, thank you for that opportunity. And I think what I want people to understand is they have the power to control their health. Okay. So sometimes people feel helpless. You just need to find the provider that you can connect with and listen to. People are not heard. They go to the doctor's office. Nobody's paying attention. They're telling them the problem. And they go, yeah, let's do this because they have 15 minutes to spend with you. Okay. And I have people that deal with pain. They will come to me. They're talking to me about their pain. But in fact, what they're actually talking about is the fact that, they can go see their daughter or something else. All of those things. So listening is something that I think I do better with. People need to feel heard. When people feel heard and they can feel trusted in a provider, the healing begins.
Yes.
It starts in them. I can recommend peptide. I can do all of those things. But if people don't trust the relationship and people don't feel safe, it takes a little bit longer. So what I do is really getting to connect with people. And it's also a relationship. Health is a journey. So let's start from here. As a pain doctor, I understand. When people comes to me, I have to get rid of your pain. So yes, I'm going to use some things, some pharmacology that will block the pain signal. But I'm going to explain to them that this is just blocking the pain signal. What is driving that pain state is your microbiome, is what you're eating, providing people. And when I solve that, not only is your pain going to get better, you're actually going to have more energy. You're going to live longer. You're going to maintain muscle. You're going to have clear thinking, which is all those things that people want. So educating people, empowering them, getting them to understand that they can do something about their situation, and going beyond that to also cheer them on. Okay? People need cheering.
Yes.
We all need somebody who can take our hand. Everybody's looking for a coach. Okay. So in my practice, I become your coach in health, and I'm learning and finding better ways. And I know that everybody's different. That's what's so important, because what's going to work for me may not work for you. And what's going to work for you today may not work for you tomorrow. So really having that wisdom to figure out where are you, what do you need, and it's all about you.
I love it. I love it because at the end of the day, it does take a village. I think my experience with, dealing with lots of people who come to me, because it all started with, they see me. Like, what are you doing? And I'm like, this is what can I do it? Okay. It's not working. What do you mean it's not working? I'm hungry. I go, it took you your whole life to gain weight. Now you've got to understand, you said about a journey.
Yeah.
What do they say about a journey of 1,000 miles?
Starts with one.
Starts with one step. And success is a journey. It's not a destination. And I really believe, and this is why as we wrap up, I want, I believe the mind-body connection and the core of the goals. I'm on the call with my coach today. And I said, I'm doing this and this and this, and it's a lot.
Yeah.
I said, I know, but I can handle it all. Yeah. I've taken this 35 years of expertise to get to this point, but I don't really talk much, because when I talk, people think I got like crazy talk comes out of my mouth, right? Yeah. But I was trained by a gentleman that said, think visionary, but then you have to think linear on each thing. So as you're thinking about your goal and you're going to travel and you're going to do this and do this every day, how much did you get up in the morning and get on? I do religiously every day, weigh myself. Because you know what Brian Tracy told me? So the Brian Tracyisms, what measure gets done.
Yep.
So when somebody says, I don't know how much I weigh, I'm like, okay. And I've gotten to the point when you probably know too, within a few pounds, because I know what I put in my body every day. If you go, I don't know, I had 6 donuts, 2 Big Macs, 2 milkshakes, and I'm wondering, I'm bloated and I'm not feeling good. And then the other side of it is really just every day with your goals, being committed to it. And like you just said, you got to change your friends. You got to get around people that support you. Look, when I get my buddy on my health journey, maybe he's ripping going, you're fat, you're not losing weight. It's because he's not on that same journey. So I worked out with a trainer. It worked for me. You know why? I had an accountability partner.
Absolutely. It's important.
I made sure that people were around me, they knew what I was doing. I had people in the business. So I say this to anybody. Get support. Get the help of Dr. Christian. He is an expert at what he does, and he's passionate. And I want to thank you for coming on the Eric Stoller Show, the Man on a Mission series, right?
Yes.
He's a man on a mission.
Absolutely.
Right? He's telling his story to the world and making his dreams a reality. This is Eric Stoller for the Eric Stoller Show with your Dr. Asare Christian at Studio 111 for the Eric Stoller Show and the Man on a Mission series. And we'll be back real soon with more exciting interviews and shows.
Thank you so much.
Thank you.